Thank you so much. Hello, everyone. Thank you for joining tonight's presentation. I'm going to share my screen. So today the presentation is called Behind Bars and Beyond Stigma, Confronting the Mental Health Crisis in Incarceration. So today I will talk about the mental health crisis currently in jails and prisons, as well as my experience working as a clinical supervisor in Rikers Island on the mental health units. So this is a little bit information about me and my contact information. I'll also put that in the chat for anyone that is interested. And the agenda for today is introductions, and I will be speaking about mental health and incarceration and some of the legislative bills that we are working on to increase services for people in the community instead of jail and prison. So currently, we do have a mental health crisis, not just in New York, but all over the United States. And as you can see here, people with one or more mental health conditions, 64% of them are currently incarcerated. 39% have depression, and 98% have one or more chronic mental health condition. And that includes psychotic, manic, bipolar, and personality disorders. 143% have PTSD and 203 anxiety. So these are very large percentages, and especially the PTSD, which we know that a lot of people that go into jail and prison already coming in with a lot of trauma, and once they're incarcerated, that trauma just exacerbates. So here is a graph on people that are diagnosed with a serious mental illness compared to the overall US population. So people in state prisons have 14% diagnosed with a serious psychological distress, and the US adults only 4%. Bipolar disorder, people in state prisons, as you can see, this is so high, and US adults only 2%. Post-traumatic stress disorder, 14%, and in the general population, 7%. And schizophrenia or other psychotic disorders is 9% in the US population, 1. And over half of people in state prisons report mental health problems. However, they do not receive the professional help that they need. And I will talk a little bit more about that when I talk about my own experience. But as we see here, only 1 in 4 has received any kind of professional help in prison. And these individuals, like I stated, are already coming in to jail or prison with a lot of trauma, with mental health diagnosis. And when they are incarcerated, it just gets worse. And then they are released into the community with very little supports. And as I said, when people are being released into the community, they have very little support. And people on probation and parole report higher rates of mental health and substance use disorders. So the rates of substance use disorders and mental health diagnosis are 2 to 4 times higher among people under community supervision. And before I worked on Rikers, I worked in an outpatient program for people on parole mandated to treatment. And we would offer substance abuse, mental health, treatment, and most of the individuals, the people that I worked with, stated that before they were going into prison, they did not have a substance use disorder. They developed one while they were currently incarcerated. So the general population is 11%, people on probation, 21, parole population, 20. And then many people under community supervision with mental health or substance use disorders also are unable to access treatment. Under community supervision, 2/3 of people with substance use disorders, almost 1/3 of people with mental health disorders are not receiving the treatment that they need. And that goes back to what I stated in the beginning, that they are being released into the community without any support or treatment. And housing. There is a huge housing crisis all over the United States. I will speak about my experience in New York City. And as I stated, people are being released from jail and from prison without adequate housing. A lot of times they do end up in a shelter that is not a supportive environment of their mental health diagnosis. And as you see here on this chart, at least 63% of unhoused people with serious mental illness will be arrested, and at least 48% will be incarcerated during their lifetime. So these are huge numbers. And I remember from my time working on Rikers Island, most of my clients that I worked with, they stated that when they were arrested, they were not on their medications and they were homeless. They did not want to stay in the shelters because in the shelters there was a lot of drug use, and often they didn't have their own room. They slept in a huge dorm, and they stated that they would rather sleep on the train and they would ride the train for days. And that definitely impacted them being arrested. So people with co-occurring disorders are 12 times more likely to be arrested than those with neither diagnosis. Housing is a central need for many people facing mental illness, substance use disorders, re-entry, repeat arrests due to mental illness, poverty, or drug use. And formerly incarcerated people are 10 times more likely to be unhoused than the general population. And about half, 49% of people in state prisons met the criteria for a substance use disorder in the year before they went to prison. So, as you've seen in my numerous slides, the percentages are really high. And in New York City, a lot of psych hospitals were closed because of the abuse that individuals experienced while they were hospitalized. And therefore, anyone who is arrested, even if they are diagnosed with a mental illness, will end up on Rikers Island. So Rikers Island has become the biggest psychiatric facility in New York. And now I can talk about my experience working in Rikers. So like I stated, I am a licensed clinical social worker, and I always loved working with people who are impacted by the criminal legal system. I worked with people on parole for over 10 years, and the opportunity came to work on Rikers Island. And of course, I heard stories about Rikers. I would keep up with all the documentaries, all of the articles, but I was told that I would be working on the mental health units, which are different than the other units because these are specialized units for people with severe mental illness. So, like I stated, the opportunity came and I really wanted to see what it was like on the inside. So I began working on Rikers Island on December 2023. And quickly, I saw how people with the severe mental illness were being treated. I supervised 2 units. One of the units was a mental observation unit where individuals would come sometimes from general population, and we would have to assess them to see what level of care they need. And the other unit that I supervised was the PACE unit. And this was the highest level of treatment in Rikers Island. This was a small unit. We had about 35 patients. There was more mental health staff on the unit. Officers were supposed to be trained in how to work with people with the mental illness, and even the public advocates and lawyers wanted their clients to be in this unit because they were told like this is actually a really good unit compared to all the other units. However, quickly I saw how they were locking people in, and there is not supposed to be solitary confinement on Rikers for people with a severe mental illness. A law was passed 2 years ago, and this law was supposed to be implemented in July of 2023. However, Mayor Adams stopped it from being implemented. So Rikers Island did have solitary confinement, but not for people with a severe mental illness. So quickly, as I stated, I saw my patients being locked in for days and weeks and even months. And a lot of my patients were 730 patients, which means that they failed their exam and they were found unfit to stand trial. So they were waiting for an OMH facility so that they could be restored to fitness. And the wait time usually was 3 or 4 months because, like I stated, there's not many hospitals in New York City. There was only 2 hospitals that these individuals can go to, and there was such a large percentage of them that the wait list was very long. So I noticed that some of my patients were deadlocked for weeks and weeks, and this is the term that they used. So when somebody is in solitary confinement, usually they're allowed to be out for an hour or sometimes a little bit more to take a shower, to make a phone call. However, these individuals were deadlocked and they were not coming out at all. So they weren't even granted an hour to be released to take a shower. And these individuals were diagnosed with a severe mental illness. So most of my patients had schizophrenia, schizoaffective disorder, bipolar disorder. And because they were deadlocked, they were not able to receive their medications. The nurse would come on the floor in the unit and give out the medications. So all of the patients had to line up to receive their medication. And because someone was deadlocked, they were not able to come out of their cell to get their medication. And quickly, what happened was that these individuals ended up smearing feces all over their cells, banging, screaming all day and night. And I couldn't believe what I saw because, as I stated, I thought these units were different and these were people with severe mental illness, the most vulnerable people, the most vulnerable population. There were times where they would come out of their cells because we would ask the officers to see. However, the problem was that the officers never documented any of this because this was illegal. So they knew that they can't document it because they would be in trouble. So the way that they knew that someone was on deadlock, they would put a white tag in the control panel where the buttons are for them to open cells and close the doors. And it had a number, which was the cell number and that button. So they put a white tag on it. So if later on or the next day, another set of officers came, if the individual had a white tag, that officer knew that they're deadlocked and not to let them out. Like a lot of times those officers didn't even know why this person was deadlocked. They just knew like, okay, there's a white tag. That means he's deadlocked. He's not coming out. So there was one incident where I had a patient on my floor and he came from another unit. And in the other unit, he was deadlocked. So because he was deadlocked on the other unit, he came in and they deadlocked him right away. And the officers, and this is, they're saying that he likes to play with shit because that's what they would say, and we're not letting him out. So he was screaming, banging, and like I said, he would smear feces all over his cell. And because of that, his cell was filled with flies, maggots, and this is how these individuals woke up and went to sleep. And ate their meals 3 times a day. So after pleading with the officers, we were able to release him. And for a week, he did good. He took his medication every day. He was behaving oddly, but I knew this was because he's diagnosed with schizophrenia and hasn't had access to his medications. And he's been locked in a cell for I don't know how long. So often he would stand by my door because my office was on the unit and just stare. And like I stated, like that did not bother me. So he did well for a whole week. And then I come to work on Monday and he's deadlocked. And I asked the officers, like, what happened to him? Like, he was out, he was doing good. And the officers were like, well, I don't know because I wasn't here on the weekend. However, a female officer from the other unit came and he was like standing close to her and just looking at her, and it made her feel really uncomfortable. So we locked him back in. And now, after making progress for a week where this individual is taking his medication every day, he's back at square one and he was banging, screaming, tearing up his mattress. And like we would have to start all over again. So I quickly realized there's not much change that I'm going to make. And I was able to transfer him to the PACE unit, which is smaller. And I remember when he came on the PACE unit, he was so scared that he was going to be locked in again. And he said to me, he kept saying, like, Justyna, am I going to be locked in? Are they going to put a tag? And I said, no, I'm going to do my best that they don't. And I told the officers, like, this person cannot be locked in. And I guess they haven't heard from the other officers what he did on the unit. So they allowed him to be out because I really do feel like if they knew um what was that he was deadlocked in the other units and smear feces, they would have him locked in. And after being on the unit for like 2 months, he was able to go to OMH and he was restored to fitness. And in OMH, he received his medications, he wasn't locked in. And I remember when he came back and it was on my last day, he was like a completely different person. He gained weight and he had a serious medical condition. So when he was deadlocked, not only was he not receiving his psychiatric medication, he was also not receiving his medications for his serious medical condition. So when he returned from OMH, like I stated, he was a completely different person. I was able to have a coherent conversation with him. He gained weight and we talked about him continuing to take his medication. And he said he will, and he remembered when he was deadlocked, and it really hurt and upset me because he was putting the blame on himself. He's like, I'm not gonna do any of that crazy stuff so they don't lock me in. And I told him, like, even if you are, like, that's not a reason for you to be locked in. He was really blaming himself for this. And that's really when I realized that there is not much that I'm going to be able to do while working there because I only have so much control. Um, so I decided to resign and look for another job. Before I resigned, I found another job. And while I was looking for another job, I connected to a lot of advocates in New York City that were working to close Rikers. So I was able to speak to them and I told them everything that I saw and everything that happened. I knew that I could not speak out about this while working there because of the retaliation. Often I advocated for my patients, and because of that, the officers sometimes wouldn't talk to me, give me the silent treatment, and I really felt the tension. A lot of times in the mental observation unit, like I stated, we had individuals come from general population. And when the individuals, for example, cursed out an officer or were disrespectful in any kind of way, the officers would come to me and would say, like, he needs to go to GP. He's not really mentally ill. And these individuals were diagnosed with a mental illness. Some of them had schizophrenia, but to these officers, they thought they didn't. And they would say, like, send him to GP. He's not really sick. He's like faking it. And of course, I couldn't disclose to them their diagnosis and, any specifics. And I knew that the right thing was for the patient to stay on the unit and I wouldn't send the individual to general population. And that made the working environment very uncomfortable because other people did this to keep the peace. So there was a lot of tension. I mean, I had an officer who didn't speak to me at all, and this officer was always assigned to my unit, and I would come in and say good morning, and like she would not even respond or look at me because I advocated for my patients. Um, they have no training in mental illness, but they would often say, like, this person's not really mentally ill. They looked at individuals who are higher functioning as someone who does not have a mental illness. So as I stated, I knew that I could not do much while I was working there. So I decided to look for another job, and I spoke to the advocates. I spoke to lawyers from a public defender law firm, New York County Defenders, who have clients on Rikers Island. And I told them that I don't want anything to happen right now because I'm still working there. However, the day that I resigned, which was September 20th, a Friday, Monday, I was on a Zoom meeting with them, coming up with the next plans for what we're going to do. So on October 8th, I testified before the Board of Correction, which oversees Rikers, and every month they have a monthly meeting. And I was able to testify in person about the conditions that I saw on Rikers Island. And the same day, a daily news article came out of what I witnessed on Rikers Island. And then I did an interview for New York One, which I would like to show you all. It's very brief. So I'm going to share my screen.
The administration says that there's no solitary confinement on Rikers Island.
Well, that's not what I saw.
Justyna Rzewinski left her job as a clinical supervisor for mental health on Rikers Island just 3 weeks ago. Her job, to work with some of the island's most seriously mentally ill detainees.
I just couldn't be there anymore, just seeing these individuals being locked in. A lot of times I couldn't.
I'm sorry, it's...
The administration says that there's no solitary confinement on Rikers Island.
Well, that's not what I saw.
Justyna Rzewinski left her job as a clinical supervisor for mental health on Rikers Island just 3 weeks ago. Her job, to work with some of the island's most seriously mentally ill detainees.
I just couldn't be there anymore, just seeing these individuals being locked in. A lot of times I couldn't even sit in my office because they were screaming and banging and I would hear them, so it was like really difficult just to pretend like it's not happening and do work.
Now she is sitting down with New York One in her first television interview to share her story. Days after uncovering a practice she says is standard operating procedure in the city's mental health units on Rikers, locking seriously mentally ill detainees in their cells for days, weeks, or even months at a time.
How long were people locked in for?
So it really depended, but I did have patients who were locked in for weeks, over a month. And a lot of the patients would like rotate from one mental health unit to another. So if they were locked in one unit, they would be locked in the other unit. So it could be a few months.
And these are mental health units. This is
Yes.
where people are supposed to be getting better or a
Yes.
higher degree or level of care.
Mm-hmm.
And they're clearly not getting that care.
Right, because when they're locked in, they're not getting their medications because the medications come on the unit, or in the bubble, so they're not able to come out of their cell to line up to get their medication. And this is not just psychiatric medication, this is also medical.
So when they decompensate, what happens?
So like they'll smear feces, talk to themselves, sometimes not move, sometimes flood the cells. A lot of times they bang and scream because they want to be released.
The process, she says, is called deadlocking.
There's a control panel where they open up and close the cells, and the cells are numbered. So they put like a white piece of paper on it, and that means that the person is locked in.
She says it happens at the city's specialized mental health units on Rikers, where she claims correction officers will decide if a detainee gets locked in their cells for extended periods of time. That decision could be made, she said, if a detainee looked at an officer the wrong way. City jail rules say lock-ins should not occur for longer than 2 hours, and no detainee with serious mental illness should ever be held in solitary confinement.
So we are looking into the allegations wholesale. So I don't have a lot of specifics with respect to that.
This week, correction officials said they will investigate her claims, but still insisted the jail complex does not have solitary confinement. The Board of Correction, the jail's oversight body, too, is investigating. At a meeting this week where Rzewinski testified, sharing her story, jail health officials did not deny the practice happened.
One of the challenges is having insight kind of generally about what's going on. So like Dr. Otonekar said, we're working on systems to help essentially identify how this is happening.
The detainee population with mental illness over the years has been climbing. More than half of detainees on Rikers Island get some sort of mental health services, according to the jail's health care provider. As of August, 20% have a serious mental illness. And now the question is, can the city care for them?
So I don't think that these individuals should be on Rikers because obviously they can't handle these patients.
Courtney Gross, New York One.
Thank you for watching. So when this happened during the October 8th Board of Corrections meeting, CHS, which is Correctional Health Services for New York City Health and Hospitals, which I was working for, the head psychiatrist and medical director were at this meeting. And after I testified, the board members asked them if they knew anything about this. The head psychiatrist said that he's heard the term deadlocking since 2017. And the board member asked the chief medical director if I worked for the hospital, and he said yes, and if he opposes any of my statements, and he said no, I don't. So they admitted that this is going on and that they knew about this. So the board members did ask them, why didn't you say anything before? Like, why did Justyna have to work there and leave to expose this if you knew this was going on? And just like you saw in the video that was mentioned, that these individuals would often scream and yell where I was not even able to sit in my office and do my work. My office was on the unit, and it was just impossible for me to look at my emails, answer emails, check charts, write things in charts, because all I could hear was like, get me out and like help, and a lot of like curse words. I remember once I even called my mom during my break, and she asked me, she was like, Justyna, who is screaming like that? Like, she heard the individual screaming. And I said that one of the patients who's been locked in for months is screaming like that. There were times also where I had to leave my office and go to the cafeteria, which was like on the other side of the jail, and eat because I could smell feces. Like, I could not even eat my lunch. Like, this is how bad it was. And I just couldn't believe what I was seeing. I ride the New York City trains every day, so I do see homeless people and the conditions they're living in, but I just never saw anything like what I saw on Rikers Island being done to people with a severe mental illness. And I often like wonder, like, don't these officers like see what's happening? I mean, this could be anyone's child, family member. I mean, that is someone's child, that is someone's family member. These individuals, they're human beings, and even though they're in jail, it doesn't mean that they have to be punished even more. And also on Rikers Island, it is a jail. So 90 something percent, I believe 97% of people on Rikers Island have not been convicted of a crime yet. So they are innocent, waiting to go through their court proceedings. But even if they were found guilty or pled guilty and they were convicted, it's not the way to treat anyone. So that's really why I decided to resign. And it was really difficult to resign. I loved working with my patients. I didn't have any issues with them. When I would tell people that I work on Rikers Island, a lot of people would say, "Oh my God, like, how are the inmates? Like, are you scared?" And I said, "No, like, they're not the problem. It's really the staff that works there and the officers." Of course, there were times where I was cursed out by my patients, but I never took it personal because I understood they're in jail, they're upset, maybe they didn't take their medication. The next day they were fine with me. However, like the officers did take it personal, and often that led to someone being locked in. And I knew I had to leave. And like I stated, it was a really difficult decision for me because I did feel like I was giving up, and I felt very guilty that like I'm leaving and they're staying behind. But knowing that I am going to do something about that and having this plan that I was going to come out with this made it so much easier because I knew I was going to be able to help them in a different way. So definitely knowing that made it easier to resign. And yeah, I felt very guilty for a long time. And it was really a hard decision to make. My mental health was also impacted. Um, in our field, they say, don't take your work home, leave it at work. But how can you do that when you're witnessing this every day? I was not able to just forget about it. I spoke to my family members. Like, Rikers was all that I could talk about. I remember even once I went to Jersey with my family, and my sister said, like, please, just, this weekend, can we not talk about Rikers? Because like that's all I would talk about. Because I just couldn't believe what I was seeing. So just dreading to go to work, not knowing what I am walking into. And once I did resign, it was just, I felt so much better. It was such a relief when that happened. And since I testified and the story came out, the Department of Corrections called in for investigation from the Department of Investigations, and I was able to meet with them and the Department of Justice because they said that they are investigating this. So I was really glad that like they are taking this seriously. And every month during the Board of Correction meeting, advocates and lawyers bring this issue up. So this is not forgotten because we don't want this to go away. From what I heard now, individuals are not being locked in for a long period of time. However, I'm always scared that they're going to, like, time's going to pass and they're going to go back to doing what they used to do. I also met with city council members and they did go and do a visit. However, because the spotlight was put on Rikers when this came out, they didn't have anyone locked in because they knew that people would be watching them. And I remember on my last day, the patients gave me cards that they made for me. And these were like large cards, and they worked on it I know for a long time because like they color things in, they made it pink and purple because they knew that was my favorite color because of like the way I would dress. And they wrote things on it, and it was really sweet to see. And I still have that card. And one of the individuals wrote on the card, "Thank you for being such a light in such a dark place and teaching me that it's okay for me to take care of myself." And that really touched me because he's right, it is such a dark place. And another individual who was on the unit and we placed on suicide watch because he was very depressed. And this was a young individual who was very outgoing, who had a job on the unit, was like the most popular person on the unit, became very depressed and suicidal. He did not want to disclose to us what was happening. So we did put him on suicide watch. And I remember when I was leaving, one day, an officer came to me in the morning and said, like, "Oh, this is for you. This patient, like, really wanted you to get this card." And that day, the patient was in court. So I saw him a few days later and he was like, "Did you get the card? Because I've been asking people, the officers, if they gave it to you and nobody's telling me." And I said, "Yes." And I thanked him for the card. And in the card, he wrote, "This road is coming to an end for us, but I hope you have a very long life." And that really touched me because even in the midst of his depression, he cared so much and wanted to do this for me. So I knew that once I leave and I would come out with this story, like this would not be the end. And I continue to advocate for people that are incarcerated. I've done a lot of talks and webinars, and I've been involved in a lot of organizations in New York City that are working really hard to close Rikers Island. Also, in December, lawyers from Legal Aid, which is a public defender, contacted me because they have sued Department of Corrections a few years ago about the lack of access to medical care. And I noticed this while I was working there. Not even the individuals who were deadlocked. They were not able to go to any appointments. Obviously, they couldn't even make any phone calls. But the individuals who were not deadlocked, they would have to call a sick line, a phone number, and they would request an appointment. And that same day, an officer is supposed to come and escort them to the clinic. That would never really happen. My patients would complain day after day that they've called, and no officer came to pick them up. Like that was very often. And what the officers would do, because then I would see it in the chart, they would write that the person refused. And I saw this myself where my patient is saying, "I haven't been taken down to the clinic." And then I looked in his chart and it said refused. So when these lawyers contacted me for me to provide my affidavit, of course I did. And there is a lawsuit regarding this because Department of Corrections said that like in a month there was 900 something refusals, and that is not true. And because if somebody is calling because they're sick and they want to see a doctor, when an officer comes, they're not going to refuse that. So as I stated, I've been involved in this work. I've been working very closely with a bill that we're hoping to pass, and I'm going to share information about this. This just has some numbers of how much we spend on incarceration. So currently in Rikers Island, we spend $1,525 per day for one individual. And like I stated, half of the current population is flagged for mental health. So the Treatment Not Jail Act, which I am a part of, is a bill to expand mental health courts in New York City so that individuals, well, not just in New York City, in New York State, so that individuals who have a diagnosis of a mental illness or substance use disorder, instead of them being locked in Rikers, they would be able to attend mental health treatment. We do have drug courts in New York. However, if you have you have to have a substance use diagnosis to be accepted, and it does not treat mental health. We do have a mental health court. However, there's only one. So the goal is to expand and to use the money that we are wasting every day by making people worse. And I'm going to show you all another quick video when I went to Albany and advocated for this act to be passed. 1 second.
We've been digging deeper into the prison system in New York for the last few weeks since a deadly beating at Marcy Correctional last month. Tonight, a group is speaking out about a proposal to make changes to the system. As CBS 6's Sean Cavanaugh shows us, it's gaining support from Albany Police Chief Brendan Cox.
What are we here for?
Treatment, not jail. A group of advocates making their case for Treatment, Not Jail Act. It supports mental health treatment instead of more jail sentences in New York.
We are going to make sure this bill gets passed. We're going to make sure that the people's voices are heard this year. We're going to make sure that the demands of the people of New York are put forward.
Supporters say almost half of the current population behind bars in the state are recommended to receive mental health treatment, but few are receiving the treatment.
For months, I languished at Rikers Island, thinking I didn't have a chance to see my daughter again.
Abraham AU knows firsthand about these issues. He spent time at Rikers Island while suffering from bipolar disorder. He says he was lucky because he was given a second chance, thanks to the mental health courts, and is now a free man and lives in his own apartment.
I was given a chance that too many of my brothers do not receive.
Justyna Rzewinski worked in the system as a mental health clinician. She says not enough of the prisoners are getting the help they need.
There's no treatment on Rikers Island. We didn't fail these individuals, we destroyed them, and this is what's happening.
Albany interim police chief Brendan Cox came out to show his support for the act.
We need far more opportunities to address root cause issues. We need to stop criminalizing mental health issues. We need to stop criminalizing substance use disorders.
The coalition has been working on this for 5 years, and many of them believe this year the act will get passed. In Albany, Sean Cavanaugh, CBS 6 News.
Thank you. So those are some of the things that I have been working on since I testified and I left Rikers Island. And now I think we can open it up for some questions, Q&A.
Thank you, Justyna, for being the voice for the voiceless and all the great work that you have done. We'll open it up for questions. And if people want to, I think everybody should be able to turn on the video now. And if people want to use the hand raising feature, and we'll call on you to ask questions. That works.
So I do see that Edmund Creekmore has put in a question, so maybe we can start with that question.
Yes, sure.
Yes.
So
yes, thank you for that exciting, enlightening, tragic story of what you've experienced. Justyna, I just wanted to share that I was the mental health director in a prison facility myself for 2 years, and I saw much of what you are describing. With patients being locked in cells and not being allowed to have that 1 hour of recreation time. And very often the warden would tell me, as the director of the unit, if you don't fill all those beds, we're going to fill them for you with general population patients. And when I was told that, I made a decision like you did, to leave the system, because I could see borderline patients that are, we had two units, one unit, locked unit for patients with serious mental illness, and the other for personality disorders, particularly personality disorders. We had patients that were very, very aggressive. And unfortunately, sometimes they mix them. And I just was not going to continue as a mental health director, so I resigned. I did want to ask you, I was intrigued by the alternative, mental health courts. In most of the states that have mental health courts, treatment courts, they're only able to um, uh, have a very limited number of select patients, a very small percentage that would benefit from mental health courts actually uh, participate, and usually it depends on a judge's being willing to start a docket, to convene a docket like that. Where do these patients live with their families? Do they live in some type of supported housing while they're under a criminal mental health court order? Where do they get their treatment? Is there a community service board
Yeah, so
that
there,
get the
yeah,
treatment? Where?
yeah, I'm sorry. So there are there's very limited community supports. Most of the individuals that get released from Rikers end up being homeless. A lot of them do not live with family. They live in those shelters. So this law would expand mental health treatment courts where more people would have access to it. And a social worker would make a recommendation. The social worker or licensed mental health counselor would assess the individual and recommend mental health treatment court. And I know that you also asked about the antipsychotic medication and um, treatment over objection. So we were able to send patients to Bellevue Hospital. They have a psychiatric prison ward. However, not many people were admitted. So because they would be hospitalized involuntarily, and the law in New York is very strict. So many of the patients they would send back the same day. And I had patients that I would send 3 or 4 times to Bellevue. And because they were locked in, and they decompensated so quickly, I would send them to Bellevue, praying that Bellevue accepts them because I know there they can actually get some help. And a lot of times when they were accepted, they came back, like I stated in my presentation, completely different people. And the problem also is when the 730 patients do go to OMH and they are restored to fitness, they come back to Rikers to continue with their court proceedings. So a lot of them do come back looking great, but then they'll stop taking their medications because in Rikers, you can't force someone to take medications. People have the right not to take medications, so sometimes they stop taking their medications and then they may act out and then they get locked in. I had patients who have been to OMH 3 or 4 times because they were restored to fitness, came back to Rikers, got off their medications, found unfit, and went back to OMH and back. So they were on Rikers for 3 or 4 years.
What about long-acting injectables? When they go to Bellevue or a psychiatric hospital, are they allowed? And are those LAIs on the formulary in Rikers?
Yes. Yes, but the patient has to consent to it. If the patient wants to take his medication, yes, they can get injections. We had few patients that would get injections once a month, but they would have to consent to that.
Okay, I'm gonna let Linda, I see her hand up, and then Jeff after that. But you think you need to unmute yourself, Linda?
Sorry. I wanted to first thank you so much, Justine, for coming here and giving us your story and what has happened in your life and your profession. And I just want to say, as someone who had a loved one who was incarcerated for over a year with no medication, allowed to represent themselves at a trial, and then finally completely backwards, then sent to a hospital for IST restoration. I have to say that I see the root causes of people ending up in Rikers, like the people that you saw, with officers that don't understand brain illness, have no idea what it's all about, and have a prejudice against people that have mental illness, treat people inhumanely, and then get away with it. It's definitely not right. And I think that what you're doing at the legislature is great, but I will say that to truly advocate for these people, we have to get down to the root causes in our country of why people are ending up in prison and jail, because part of it is that people don't understand untreated psychosis and that those people cannot give consent for voluntary treatment. And so until they get treatment to bring them back to reality, they can't consent. And it's just like, my mother had dementia. She still got treatment, even though she couldn't consent. And every other illness is like that. And it is just, I mean, your story brought me to tears. It's inhumane to put somebody in this. I mean, I know you know that, but it's just so shocking. And if you hadn't spoken out on TV and carried this forward, that we wouldn't have this issue at the forefront in New York. So, I think that I'm in California. So we try to do that in California, but, and we have horrific incidences in our prisons and jails. It's all over the country. So hopefully with this movement and with somebody like you who has actually seen what these people are doing, that is illegal and going after them, I just can't even thank you enough.
Yeah. And when you mentioned the officers don't understand brain illness, that's so right, because a lot of times I don't know if they just didn't get it or they use it as an excuse. When I would advocate for someone to be let out, they would say, well, I can't let him out because he's smearing feces. And I would say, yes, because he's locked in. And they were like, I can't let him out because he's banging and screaming. And I would say, yes, because he's locked in. So like I said, I don't know if they just use that as an excuse, or once I had an officer say to me, well, we keep moving his cell and he keeps smearing feces. And I'm like, yes, because you move his cell, but you keep him locked in.
Yeah.
So, yeah. Jeff?
Yeah, I wanted to ask you if you've heard of the system that Judge Leifman has developed down in Miami. I've read a little bit about it. I've seen videos. I've seen like just videos on the system, and it seems to be working pretty well down there for those of us that have been diagnosed with an SMI. And it seems like that's a pretty good model that the rest of the country could use. I wonder if you've seen that.
No, I have
No, you
not.
haven't. Okay. I can
What is
explain
the
a little bit.
name?
It's the judge. You want to go in?
You're right, Judge Leifman.
Judge Leifman,
Yeah.
yes.
Yeah, right.
In Miami.
Exactly, yeah.
I'll definitely look that up.
Okay, there's a question from Sonia here. And is, oh, a minute, let's see, I think, yeah, here it is. And is there a discussion in New York on housing options for people who are incompetent to stand trial, unlikely to restore, and in the community? They are too acute to engage meaningfully in voluntary services and not acute enough for inpatient as they are at baseline, so they will not benefit from further treatment. This is what I am working on in Texas right now.
So, I mean, this is why we want to pass this bill. And also, it is the law for Rikers Island to be closed. It is supposed to be it was supposed to be closed by 2027, but that's not going to happen. So they are building smaller jails in every borough, because I'm not sure if all of you know, like how Rikers Island is set up, but it's on an island and it's very difficult to get on the island. So for a lot of family members, lawyers, it takes a whole day just to make a visit. It's like another world and everything is like hidden, like from everyone. So there's a lot of advocates who are working towards closing Rikers Island. Right now, the Department of Corrections budget is $2.8 billion per year. When they close Rikers Island and have the smaller jails, they will save over $1 billion, and the plan is to invest that money into community supports such as housing. Right now, I don't know what the budget for mental health services. I mean, it's all for like DOC, the budget. They have positions for 7,000 something officers. Right now they have 5,000 officers. There's 6,000 people incarcerated on Rikers. They don't want to close those vacancies, so we're wasting money for these open vacancies when there's enough officers for everyone on Rikers Island. So they have a humongous budget, and that's the plan, to close it, build those smaller jails in the community, and invest that money into mental health, treatment, housing, community supports.
Eric?
Hello, yes, two things. First off, thank you so much for speaking. I got really like emotional watching, and just thank you for speaking out. And also, one thing before I get to my question, Judge Leifman, PBS Frontline had a documentary, The Definition of Insanity, that he was featured heavily in. So if you're interested in him. And also, I have a question. What advocacy groups have you reached? Have you coordinated with any advocacy groups in New York, like NAMI, TAC, or even like some of the civil liberty groups? And have any of them been useful in your advocacy?
Thank you. So I did speak to NAMI. The executive director of NAMI New York did reach out to me when the story came out. We had a meeting. They were actually there at the event in Albany with Treatment Not Jail. They advocate for that. And then other organizations, Freedom Agenda, which is leading the campaign to close Rikers Island. Tomorrow, actually, I'm speaking at a rally for them because the city council is doing the budget. So I'm going to be speaking about the budget and why Rikers Island needs to close and why we need to invest in community supports. So that's one organization. I've also been involved with HALT, which is the law that limits solitary confinement. That law was passed 2 years ago. And that law, anyone under the age of 21, anyone that's pregnant, over the age of 55, anyone with a disability cannot be put in solitary confinement. For 11 days, it's been, I think, over 2 weeks, the officers in the prisons in New York have been on strike. They just walked out of their job, and the governor had to send in the National Guard. And what they're saying is because the HALT Act, ever since it was passed, has made very unsafe conditions for them. They refuse to go back to work, and it's an illegal strike. So I've been dealing a lot with that. I work with those people that helped pass the bill, and it has been suspended right now, the bill, because the governor is trying to get them back to work. This is also because they went on strike because the killing of Robert Brooks, who was a person incarcerated, who was beaten to death by the officers. It was all over the news. And on Saturday, there was another beating reported of a 22-year-old individual who died because of the beating of the officers. So a lot has been going on with New York and the prison system. So I work with that organization. Also, another one called Solitary Social Workers and Allies Against Solitary Confinement. And that coalition, we're working on a bill. The bill has been written already. We're going to try to pass it this year where it would mandate every healthcare professional to report any form of abuse that they witness while working in a jail and a prison. Because, I mean, I spoke a lot about the officers, but I was working with mental health staff who a lot of times acted just like the officers. And the psychiatric nurse practitioners had all of the patients on their unit were their patients, and they saw them deadlocked and they saw smearing feces, and they never reported it to anyone. Even in the Robert Brooks video, there were two nurses just standing by. One of the nurses was laughing while he was being beaten to death. So we're working on that bill. So if any healthcare professional witnesses any form of abuse, they will be mandated to report that. And that organization, that agency would be the Justice Center in New York.
Thank you.
So Justyna, right now, there's no accountability for the clinicians to report that abuse?
No. And I couldn't believe that nobody is reporting this. And I often thought, like, if this was happening like anywhere else, we would be reporting this. We're mandated reporters. And after I did speak out, a lot of the mental health staff were very upset with me. People that I would talk to that I was friendly with on Rikers, who were clinicians, mental health staff, who complained also about people being locked in, have not spoken to me at all. And I do have a friend that still works there, and like he told me like everything that they're saying about me. And it's just been, I just can't believe it because these are licensed professionals.
Is that because they're afraid of repercussions from the guards?
That's why people don't speak out. Because like I stated, I would never be able to speak out and work there, but they don't have to speak out now. Like they could be happy that I did this, but they're upset. A lot of people that work there have this mindset like the officers do, even though they're mental health.
That's terrible.
Eric, did you have another question, or was your hand?
Yes.
And also, I'm sorry, and also I was told that when the mental health staff, after I spoke out, would go on the units, the officers would say to them, like, here come the snitches, like all this stuff. And obviously they had nothing to do with it. It was just me, but they were saying that to all of the mental health staff. And then they said that I left because I couldn't handle the job. But Eric?
Yes. You say you're advocating with these groups for treatment in the community. It's been my experience with a lot of, say, prison abolitionist groups or civil liberty groups that they oppose mandated outpatient treatment programs like Kendra's Law or assisted outpatient treatment. And if people are like, I said, no one here wants these people to be incarcerated, and especially not in solitary. But when I was off my medicine, I have a diagnosis of schizoaffective disorder. It took a lot to get me on my medication, and just having them out of Rikers without, some of them will need mandated outpatient treatment. And my question is there any talk about, say, yes, close Rikers definitely, but mandate outpatient treatment once they're discharged?
Yes, because that would be like the part of it. And also if they are in mental health court, like their treatment would be mandated. Like that would be the condition that they're in mental health, they would have treatment. And also, housing is such an important issue because in New York City, like I stated before, these individuals do end up on the streets. I know the shelters that most of them live in and is not for people with mental illness, and there is drug use. There's one particular street that everybody knows of, and refers to it as zombie land because everybody's getting high on K2. So this is where people are being released. And I worked with people on parole, and I would see them go in and out of Rikers, come back to the same environment, use drugs, not take their medications, and then just go back to Rikers and come back to that same environment. What is the consequence? That's a good question. I don't know what the consequence would be if they fail to comply. But I would have to look into that. But the goal is really to provide like stable housing for them and an environment where they're being monitored, where somebody is checking up on them and asking, like, did you take your medication today? There was one individual who was released from Rikers, and a month later, he stabbed 3 people to death in the street randomly, and he had a diagnosis of schizophrenia or schizoaffective disorder. And that's because, like, he already did his time, so Rikers had to release him, but he was released into the community with nothing and stopped taking his meds and just was walking in the street. Yes, that would be the goal. Also, because when Rikers does close, the smaller jails are smaller, so the population would have to go down. So it would be inpatient treatment. Like the goal is for them to never return to the jail. Even if Rikers closes and the jails are better, like at the end of the day, it's still a jail. It's not where a person with a mental illness should be, even if it's like the best jail in the world. It's still a jail. It's still a prison. Laura?
Well, coming from Massachusetts and as a mom to a young 20-something-year-old with a serious mental illness in a jail population who was put in isolation, I just wanted to say that your colleagues are wrong to criticize any of this, and that we as parents who have no idea what's happening to our children, adult children inside those walls, depend on people like you to speak out or to give heart to a situation that definitely needs it. So don't listen. And thank you so much.
Thank you. And also, while I was working there and I witnessed this, I did witness a pattern where they would lock people in who were lower functioning. I'm assuming they may have had some developmental disabilities. I don't know for sure if they did or not. And these were individuals who didn't have a lot of community supports because the officers knew that there's not going to be people that would advocate for them. People who had family members and were on the phone with them all the time, they never locked those individuals in because they know once the person's locked in, that family member is going to be calling the jail saying, I haven't heard from my husband. So it was often those individuals who didn't have that community support.
Justyna, do you know if there's any type of training that the correction officers have to undergo for mental illness?
No.
There is none?
There was a CPI training. It's to de-escalate, but not all of them are trained because when there was a situation, they would call on like civilians. They're supposed to be trained. That's why these units they were told that are like special units because the officers are trained. And I remember I asked one officer, I was like, oh, do you guys get any mental health training for working on these units? And he was like, no, I can do this job with my eyes closed. And I said, yes, just like last week when you and the other officer were asleep on the unit. Asleep, both of them. We had to go up to them and like scare them to wake up. And the patients were on the unit and they're just knocked out sleeping.
And it's very obvious that your colleagues didn't get the right training in med school or social work school or wherever they've gone. And that's another huge problem in our country because it's also at the judge level, the lawyer level, the attorneys. I mean, throughout the entire system. They don't understand serious mental illness, serious
Yeah,
brain.
even the mental health staff would tell me like, oh, he's faking it, send him to general population, he's disrespectful, or he exposed himself to me. And I would say, okay, this is jail. Like, what did you think was going to happen? And then I didn't send these individuals to general population, and there was a lot of tension, and sometimes they wouldn't even speak to me because they want. Also with substance use, there was so much substance use K2 that if an individual was using, a lot of the mental health staff were like, well, he's using K2 and he's sharing it with the other people who are really sick, like send him to general population. But these individuals actually had a mental health diagnosis of schizophrenia, so I wasn't going to send them because they're using drugs. You know, I wanted to work with them on their drug addiction and the problem. Like, that's not going to be beneficial to send this person to general population where he has even more access to drugs.
Or if they're untreated psychosis, like my family member, they got beat up by gangs. Even though we sent over and over again the medical diagnosis, the medical progression, everything, they didn't listen. And they just put them in general population. That's dangerous.
Yeah, it is. It is. They get taken advantage of.
Yes.
Eric?
Yes. I apologize if you said what was it K2 is and I missed it, but can you explain what that is?
So it's like synthetic marijuana, but it's not marijuana. They say it's synthetic marijuana. It makes people hallucinate. It's very cheap. Um, and it's just horrible for anyone's mental health. Um, and there's so much of it on Rikers Island, but it's just, yeah, it's horrible. People hallucinate and I'm sorry.
Is K2 legal in New York?
It's not. So this is why it's complicated, because K2 is usually like a mixture of a lot of things. And in substance abuse programs, it's very difficult for someone to come out positive for K2 because there's so much stuff in it that like people don't even know what they're smoking. Like I heard there's like rat poisoning in it. Like people just put so much stuff and it's so cheap. But it's sold in stores and everywhere. And a few years ago, when it like started to get bad, like there's a lot of documentaries about it in certain areas in New York where people are getting high and hallucinate and run in the street. Sonia?
Actually, I feel like I should because I've been blowing up the chat, so I'll wait, but I know Jeff has his hand up and then I'll go.
Okay, yeah, I just wanted to share out here in San Diego, they came up with something called the Care Court or Care Act. They were trying to solve the problem of people being recycled through like jail, homelessness, hospitals, and that they were trying to solve that problem. But as far as I can tell, they didn't take into account anesthesia, and they made it completely voluntary. And a lot of the guys that are experiencing psychosis or schizophrenia or schizoaffective aren't aware of their illness, and they just want to give up on the system. They just don't want to flake out. They don't want to do it because they're not aware of what's going on within themselves. So I just want to share that real quick as something we gave a shot, but didn't quite get to the point where we could solve that problem of the recycling.
Yeah. Right, because individuals may start feeling better, and then they think like, I don't need medication, like I'm fine, and then they stop and it just continues.
And Jeff, the people who worked on it actually pushed anesthesia. That was like the root thing for the CARE Act, but it was because of so much opposition of the people who are like, you can't force people into treatment, you're taking away their civil liberties. So I think they're still working on it, but
definitely still working on it.
Yes.
To let you know, on the legislation, tweaking it.
Yeah.
I'm on the grave disability workforce or work task group or whatever, and we're trying to get it reframed because that was the promise of it, right? To families, to get their very sick loved ones who don't know they're sick into treatment. and the promise was not fulfilled.
Right. And that's what I was going to say. So I do really want to connect with you, Justyna. In Texas, so I got a bill. We meet every other year, which I used to think was terrible, but because we're so terrible, I'm like, this is probably better that the ledge is only gathering every other year. But last session, we got a bill. So Texas is almost unparalleled. I think it is unparalleled with the investment we've made in a state hospital system redesign. But the strange thing is that we put in 2.6 billion and we're continuing with the expansion, but it's really seen as acute care model, which I keep telling people reality is state hospital is residential treatment, right? It's a misnomer. It's like the residential treatment with no time limits. You don't want people to just be stuck forever, but you do want to get to the point of what does a person need to be successful in a community? So we did a study, a 5-year look back of our competency restoration wait list. So in Texas, in the period we looked back, so up 18 to end of 2023, we put over 15,000 people on our competency restoration wait list. And there are a ton of people who are we never looked at the number of incompetent, like unfit. We just said the people who actually made it to the list. They left out a lot, but 10% recycled like over and over with new charges, meaning they need a higher level of care. And so that's what we're really trying to push. And Arizona has been really on the forefront of this in between hospital level care and community placement. And I don't know anybody who does this work. Like with New York, in my hearings here in Texas, I always refer to New York and I'm like, why, in the case of the death of Jordan Neely, is a forensic psychiatrist saying they reviewed over 5,000 pages of his records from Rikers? What were we doing? And nobody's talking about that. They're talking about who killed him, which was awful. But why did we just keep throwing him back? And why aren't we building out that system of care? So
because there's no place. The individual will do their time. So regarding legal, they have to release him, but then they release these individuals to no supports, just to the streets.
Right. And that's where I'm really hoping. I just met with Washington State because I don't know if you know, but the original case that everybody's followed, where we're suing states for not getting people out of jail fast enough for competency restoration services. That's the True Blood case. Ironically, the judge in Washington State said, okay, we've got all these people in jail, so y'all need to move the civil people out to make room for them. And the lawyers came back and said, the irony is these people you're kicking out were your original plaintiffs. And when they got here, we realized they are very acute and need longer term care. They shouldn't live in a hospital. We need something. And now Washington State is building a 350-bed forensic only state hospital, meaning I have to commit a crime to access the public mental health system. So I'm really trying to meet with states because I want us to gather information across states. We have to change federal regulations that 190-day lifetime limit under Medicare for inpatient psychiatric treatment. I don't know if you're aware of that, but it doesn't matter the size of the facility. If you were so sick that you were on Medicaid and now you could be 26, I'm going to put you on Medicare. And now for the thing I gave you this funding, I've left you unfunded. That's impacting homelessness, incarcerated populations, and people need to start asking the same questions and submitting that to the federal government, I think. Because too many people are now on the other side of what you're doing, where they're like, this isn't working. Why are we talking about diversion? Why are we doing this? Lock them up, get them out of the streets. I'm sick of it, And I'm seeing that full blast in my legislative session right now, and they are very closely tied to Washington. So I want to follow up with you because I think all of us joining forces is so important.
Thank you.
So does anybody have any questions before we end? Justyna, thank you so much for a great presentation. And this will be available on our YouTube channel probably sometime by tomorrow afternoon.
Thank you, everyone. Have a great night.
Thank you.
Thank you so much.
Thank you, Justyna.
Bye.